Welcome to St Michael's Hospital. You have chosen to have your dental treatment whilst asleep. This video has been made to help prepare you and your care team about what will happen on the day. You and your family or carers will come in through the front door. You will then turn left and go down a long corridor. At the end of the corridor is the reception area. You will go to the desk and meet the receptionist.
Hi there. Hello. Hi, I'm the receptionist. Can I take your name so I can tell the dentist?
Your carer will tell the receptionist your name and ask you to take a seat whilst you wait for one of the nurses to come and get you. When you meet the nurse, they will tell you their name and lead you onto the ward.
Hi there, I'm Debbie. I'm the nurse who'll be looking after you today. Okay, would you like to come through? Thank you. Come on then.
You will then go through the doors and down a corridor to your private room. Your family and carers can come with you. This is your room, which has its own bathroom, where you'll find a toilet, shower and sink. There are also chairs and a bed in your room. You may want to take a seat on one of the comfy chairs whilst you wait for the rest of the team. After a little wait, you will then meet the anaesthetist. The anaesthetist will come and say hello to you. They are the doctor that puts you to sleep and then wakes you up when everything is done. They may want to look at your hand and talk to you about the different ways you can go to sleep. They will check you don't have any questions about going to sleep before they go.
And is it Emily?
Yeah.
If there's anything you'd like to ask about the anaesthetic, just let me know.
Thank you.
Okay, I'll see you a little bit later on. Thank you.
You will then meet your dental team.
Hi there, I'm Tori. I'm one of the dentists.
Hi, I'm Kieran.
The dentist will come and say hello to you. Usually there are 2 dentists. They will go through some paperwork with you all and make sure everyone is happy with the plan.
So as we talked about when you came to see us before, so today we're going to have a look at your mouth whilst you're asleep and do any treatment that's necessary. Okay?
They will also check you don't have any questions before they go.
Have you got any questions? All happy?
Yeah, sounds good.
We'll see you later.
Hello again.
You will then meet the nurses who will be looking after you. They may pop a little gown on top of your normal clothes. The nurses will put a wristband with your name on it around your wrist. They may put some cream on the back of your hands and pop a little sticky plaster on top of this. They may also take measurements like your blood pressure by putting a band around your arm. They may check the amount of oxygen in your blood by placing a little plastic tube on one of your fingers. The nurses may check your temperature by popping a plastic tip in your ear. None of these cause any discomfort, but if you don't feel like having them done, don't worry, we can always take these measurements later on.
Yeah, well done. Thank you. All done. I'll take this off now.
If you want and are able to, you can make yourself comfortable on the bed. Sometimes we use special equipment to help you do this. The nurses may give you a special drink. This drink will make you feel a little sleepy and a bit more relaxed. When it is time for your operation, the nurse will come and take you to the treatment room on your bed. Your family or carers can come along with you. This is the room where you will go to sleep.
Hi there, nice to see you again.
The dentist will be there. Once you're in the room, the whole team will check your wristband and make sure you're feeling okay. They will also double check the plan for when you're asleep. They will check the equipment and they will talk to you about going to sleep.
No, machine is checked and we have an airway plan.
Fantastic, thank you Andy.
Good. Emily, you can come in nice and close.
Your family and carers are still with you, and if you want, you can hold their hand or one of the nurse's hands. The anaesthetist will put the same plastic tube on your fingertip which you had earlier, and you may hear some beeping sounds.
You'll be able to see yourself on the monitor here and hear a beeping.
The anaesthetist may give you a mask to put on your face.
And the anaesthetic comes through here.
My hand.
This will help you go to sleep.
So what we'd like you to do is take some deep breaths with your mouth here and your nose up here. Do you want to hold this yourself?
The doctors and dentists will look after you whilst you are asleep. After the operation, you will wake up in the recovery room.
Hello. You're just waking up from theatre. You're doing really well.
A nurse will be there to look after you, and they will let you know their name. They may give you some medicine. The nurse will make sure you're okay and not in any discomfort when you wake up.
Have you got any pain at all? 0 being no and 10 being yes. How much pain have you got? Oh, that's good. Your carer's just on their way.
A member of the team will bring your family or carer to this room to see you.
How are you feeling?
The dentist will also come and see you and your family or carers and let you know what treatment has been completed.
Hi there. You've had all your treatment done now.
They will let you know how to care for your mouth over the next few days. The dentist will also give you a leaflet with all of the information written down in it.
We're also going to write a letter to your dentist telling them everything that's happened, and they will look after your dental care going forward. Well done.
When you are fully awake, the nurses will take you back to your room on the ward. You will be with your family or carers.
Just going to go back to where you were this morning.
Hello.
Right.
Yeah.
Hi, how are you doing? Okay.
So this is Barbara. She's had dental surgery.
I'll just take all these off.
They will remove the arm cuff, plastic tube on your finger, and any sticky labels before heading back. When you are back in your room, you can have something to eat and drink, and your family or carers will be right by your side.
Hi there. Okay, if you're ready and happy, it's time to go home. Let's go.
The nurse will come and get you and let you know when you can go home. You'll walk back down the long corridor the way you came into the hospital. If you have any questions, you, your family or carers, can let us know before you go.